Hello, my name is Gary Schwander, sports massage instructor here at the ASHA School of Massage. I also work in the ASHA Wellness Clinic. Today I'm going to talk about some structural imbalances to the upper torso. So when you come in here to get a session at the clinic, again, one of the main things we look at is that the body is in alignment. So when you look at the skeletal chart, you'll see a line going through the nose, through the chin, through the sternum, the whole way down, through the pelvis. From the side, we want the ear lined up with the shoulder, with the hip, with the knee, and with the ankle. So one of the main things we see when people come in is people complaining about soreness and tightness in their upper back and up into their neck. So when we do our postural assessment, one of the most common imbalances we see is the head slightly forward, shoulders rotated inward. And so people are complaining of problems in their upper back, but what's really happened is these muscles in the front have gotten tight because we do so many activities with our arms out in front of us. We're driving our cars, we're cooking meals, we're working on our computers, we're doing massages. So we spend all our time with our arms out here, so these muscles have gotten tight and contracted in the front. And what's happened is these muscles in the back, it's like pulling on a rubber band. They've actually gotten lengthened and weakened. Because if these muscles were tight, we'd all be walking around like this, but instead most of us are walking around like that. So we want to get a balance between these tight, contracted muscles in the front and these weak, lengthened muscles in the back. And so here in the clinic, we use a number of different techniques. We use structural integration, myofascial release, neuromuscular therapy, and muscle energy techniques. So I will demonstrate some muscle energy techniques for the pectoral muscles to stretch them out, and also for the subscapularis, which is actually between the scapula and the ribs, and that works to internally rotate the arm, which will affect this forward arm position. So I'll demonstrate on my athlete here. So Alicia, you want to scoot over to the edge of the table? So I'm going to start with her arm out, and what we're going to do is a stretch where I will stretch the muscle for my athlete, and then she's going to do a gentle isometric contraction using about 20% of her strength. And then we have post-isometric relaxation, which will allow the muscle to release and get stretched even further. So you're going to take a deep breath. And as she exhales, I'm going to stretch down this way, which is going to stretch the pectoralis major. And now she's going to use about 20% of her strength and try to lift her arm up towards the ceiling for 5 seconds and release. And then we'll be able to stretch it a little further. And she'll press up again and release. And then we'll stretch a little further. Is that okay? And she'll press up again. And release. And we'll do that one more time. And release. Okay, so that'll get the pectoralis major. And now slide over to the middle of the table. So for the subscapularis, which internally rotates the arm, what I'm going to do is I'll have Alicia take a deep breath, and as she exhales, I'm going to stretch the arm up this way, which is actually externally rotating, which is going to stretch the muscle. And now she's going to internally rotate to contract the muscle, and relax, and then we'll stretch a little further. Is that okay? And push up again, and relax. Again, and relax, and we repeat that 3 to 5 times, so we'll do that one more time, and relax. Okay, so that will stretch these muscles in the front that have gotten tight and contracted, and then I would give Alicia some exercises to do which will strengthen these muscles in the back. So we want to stretch these muscles in the front, strengthen these muscles in the back to bring the body back into alignment. So thank you for watching our video, and look for continued videos where we'll demonstrate some other techniques.